Greetings. My name is Dr. Lipi Roy, and I'm an addiction medicine specialist. Today, I'm going to talk about the neurobiology of addiction, or in other words, the role of the brain in substance use. So there are three main parts of the brain that play an active role when it comes to substance use and addiction. The first region of the brain is called the basal ganglia. This is the part of the brain that's involved in motivation, reward, pleasure, learning behaviors and habits. So when we do things that we enjoy, like say going for a swim or watching your favorite TV show, in my case it's Big Bang Theory and The Mindy Project, or say eating a slice of cake or drinking a glass of wine, whatever you do that brings you pleasure that you enjoy, it's the basal ganglia that's really responsible for the motivation, the pleasure, secreting the pleasure neurotransmitter dopamine. A second part of the brain that's involved with substance use addiction is the extended amygdala. This is the part of the brain that's involved with emotions, the reactions to stress, the fight or flight reaction, part of our sympathetic nervous system. So when you see a car coming towards you, or an angry dog or a bear, it's the extended amygdala that's responsible for our body reacting to that stress. You fight or flight, you run away. It's also the extended amygdala is also involved with negative emotions like anxiety, irritability, stress. The third part of the brain involved in addiction and substance use is the prefrontal cortex, which is at the front of your brain, and it's involved with what's called executive function. In other words, organizing thoughts, decision making, time management, all these things that you and I take for granted that the second nature. So for instance, this morning, you woke up, brushed your teeth, washed your face, coordinated you picked out your clothes, made breakfast, maybe you looked on your laptop, got some work done, and did all of this before you left for work. So that might seem like common sense, it's second nature, but imagine all of the decisions and the thoughts that happened in order for you to do all of those things. So now, imagine all of these complex decisions and emotions and thoughts. Imagine doing all that, but it's hijacked by drugs, alcohol, heroin, tobacco. So, the addiction cycle. Think of three stages. The first stage is called binge or intoxication. It's when a person consumes an intoxicating substance and then experiences its rewarding or pleasurable effects. Again, think about that glass of wine, piece of chocolate cake, or whatever it is that brings you joy or pleasure. The second stage of the addiction cycle is the withdrawal or negative affect stage. So at this time, an individual experiences a negative emotional state or when they are no longer using that substance. Okay, so if when you're not taking something or using something that you enjoy, you get a little irritable, anxious. That's that second stage. And then the third stage of the addiction cycle is known as preoccupation or anticipation. This is when a person wants to seek a substance, or they seek a substance after a period of abstinence. Think about a very famous and talented actor, Philip Seymour Hoffman. He was in recovery for over 20 years, and then he relapsed. That's that third stage when when a person seeks whatever substance, drug, after a long period. It could be a period of maybe a few days, weeks, months, years, decades. So those are the three stages of the addiction cycle, and that's when the drugs and substances are really hijacking your brain and controlling, impairing your ability or a person's ability to make decisions. They'll do things that are harmful to themselves and to those around them because drugs are impairing or controlling their ability to make otherwise healthy and safe decisions. Stay tuned for my next video on addiction, health, and society. Thanks.